he said he or his family said they took to help us. Our son, our daughter have ingested, we have a psychic trouble, we have a trouble, family trouble, and she have ingested 2 strips of drug. Okay? What to do? You have to do what's called nasogastric intubation and gastric lavage. Okay? How to do this gastric lavage? We have to ask, is our patient conscious or comatose? If she is conscious, I have to talk to her. Hi, my name is Dr. Shaban. Inshallah, we are going to do what's called nasogastric intubation. We will introduce a tube like this through the nose to the esophagus and till the stomach to remove what you have ingested, because it is dangerous for you. Okay? Don't worry. Inshallah, it will be easy and will pass through it. What I have done, introduction of myself, and in illustration or discussing what is going to happen, not to get direct to the patient and the interview will be afraid and he is not oriented about what's going to happen. Okay? I have done this. Then I have to ask about our way. This is the note. Okay? Did you have any nasal trauma? No. Did you have any nasal surgery? No. Do you have any common cold, any infection, any trouble? If no, okay. If yes, we have to be according to the situation. If the blade in place, the other, so this is more patient than the other one. Blade, snip, like this. Then I will put nasal decongestant like this. It's called after intervene. It has many names. It is nasal decongestant in each nostril like this. Then I have to choose our tube. She is a female of 10 age or 8, 20. So what is the fifth one? The green or the orange one? The green or both can use. Why? This tube we don't have the black one or the white one, but this is our most commonly used tube. The red one is the adult one, and this is for the adult but small one. This is can be used for female, and we will start from the wide one. If it is not introduced easily, I can use the less size. Why? I have to put the most appropriate one to get a large amount of content. We have a fragment tablet, we have any thing in the stomach should be removed. So I will use, inshallah, this orange one. Its size is 60 French. This is 18. This is 16. This is 14. Okay? The black one is 10. The white one is 12. 10, 12, 14, 16, 18. I have waited about 5 minutes till what nasogastric the decongestant have worked. Then I will, this is a maneuver, an invasive maneuver. It is painful. Okay? So I have to anesthetize this pathway to get comfort with our patient. I can use a lubricant gel, like xylocaine. Okay? This is supposed to be a lubricant gel. It will be put in the nose. How to introduce the gel through the nose? Like this. Ask the patient to obstruct one nostril, then put this like this, and inject 1 centimeter by 1 by 1, and ask the patient to do what? Sniff and swallow. left hand swallow. Okay? If you put this like this and the patient is not doing anything, it will be on the ground. If the patient has an excessive gain, vomiting, just touching her nose, she is vomiting. Okay? I can put this anesthetic spray in the mouth to decrease the gain reflex. Okay? But it is not put in the nose because it is irritant to the nose. So the spray in the nose or the varnish spray where? Mouth and the gel in the nose. I have chosen this tube. I will do like this. This is our tube. How to introduce? I will put this and this is enough, or I will put till the end. I have to measure when to stop. Okay, so I will measure from the what shape of the nose, the view of the ear, then the quiet process like this. Why? Because we have short, long. Okay, this end where I finish has to be marked by a tab. Why? Because when I introduce, this is our end of introduction. When you measure, you have to start from this one. Why? This one will be in the stomach, and this one will be out. Don't measure like this. Okay? We have this tube. It has a bore like this. Through it, I will put a large syringe, and the other end have 4 openings, 2 on each side. Why? And it end is slight. It is obliterated from its tip, and the openings are on both sides.Hy on both sides, not at the end, and this is not. What is the benefit, extra benefit of these 4 foraminate? Then a 1 at the end and no more. What do you think? Increase the surface of suction for more than 1. Why on both sides? If a one sticks to the wall, the other is still open, and the other like this. Why from the end, not from the end? Because if the end is open, it may be sharp and can penetrate the wall. So I have measured like this. Okay. How to know the record process? How to know? It is like this. Midway between the 2 nibbles, below the internibble line by 3 fingers, like this. Okay? Below the internibble line by 3 fingers. I have marked this. I will just put a tab to have that, to know that this is our end. Measure again. If I don't have a tab, this tube has 1, 2, 3 marks. I can say it is a mark number 1, midway between mark number 1 and number 2. Before I introduce any tube through the body, I have to lubricate it. If this is tube in rail or a catheter, I have to lubricate it by lubricating gel. Okay? Then this tube is supposed to be straight, and our way is curved. So I do like this and do like this, switching or curving this one to be like this, to be fitting the pathway. I ask the patient to be calm, and he is conscious for his sitting. I introduce gently. If you feel a resistance, you can try gently, not be aggressive. Okay? If any obstruction, stop and look at the other one, so it is more easy. If it is completely obliterated, charge this and use the smaller one. But try and you can do this like this. We are now in the pharynx. So the patient doing like this. Okay? So he is obliterating his pharynx and trachea. I asked the patient to sit or drink small amount of water while to open the esophagus and close the trachea. So drink, okay? After passing through this way, it is easily moved. If you have reached and you feel a resistance, you can do like this. Twisting the tube 180 degrees. Like this, to be like this. Why? What is the idea? This is our way. When you feel a resistance, you do it like this. So it gets like this. Not to be in the first one, which is trachea, but to the back one, which is the esophagus. So introduce, drink, twist, introduce rapidly till what? The tab mark. How to confirm we are in the stomach? As we have mentioned. Muhammad, are you okay? Not okay, but I'm good. Okay, so is talking. I have to look at by a flash of light. We have to suppose that it's a flash of light. It is not coiled in his mouth, so it is passing straight. Then I have to do this suction of the content, so it is getting a gastric content. How to confirm it is a gastric content? By look at me. Before I remove the syringe, I do like this, not to get like this. And I put it on litmus paper, which is not available, okay, and it is not practical, but it's a confirmatory method. You have to mention it, turn the blue one into red one. Then I get 10 to 20 centimeter away and inject it in the stomach rapidly and putting the stethoscope on the stomach and listening to what? Bubbling sound. Okay? So we have mentioned 4 confirmation. 1, talk, 2, look, 3, suction, 4, injection. Number 5 is X-ray. Then I am sure I am in the stomach. I will fix this tube by a tab on the nose, by a Y-shaped tab. It's like this. Okay, this tab is open like my finger, and putting the unopened one like this, and twisting this like this, and this like this. This is the tab. Then I want to do gastric lavage by putting the position in what? Left lateral position. Okay, and the head is down. Why down? If any vomiters, not asparagus. Then I do this. Repeating this until what? Empty. Until nothing comes out. Until nothing comes out. So I am supposed that I have finished what? I have finished the emptying of the stomach. I can do an extra maneuver by abdominal massage of the patient, and this helps to get more content. After I have finished this, so the stomach is supposed to be clear. I have to wash. Walaikum salam. I know, but how?
لا انا اصلا معلش بس كان معانا بس واحد قريبنا في الطوارئ ففضلنا واقفين معاه لحد ما نخلص.
هاتوا كراسي وقعدوا.
نعم؟
هاتوا كراسي وقعدوا. عينكم ماله؟
ايه؟
ماله؟
لا كانت حالة كده كان عنده حصوة صدر اليوم خالص. احنا دلوقتي عملنا انترودكشن للنيزوجاستريك تيوب، نعمل جسم ده دلوقتي. ماشي؟ ده سكيلر.
طب هو ده دي بي ال
اللي هو
نفسك بسؤال لافاج؟
لا ده نيزو جاستريك.
نيزو جاستريك.
التاني اسمه ايه؟
دي بي ال
اللي هو اختصار.
نفسك بسؤال لافاج.
لا 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 لا
ده لازم هو بقى
الدنيا اللافاج ده من هنا من هنا، ده قصه تانيه خالص. ده نيزو gastric infusion. We have removed every content of the stomach. Then we have to wash by a clean water, tap water or saline. By doing like this, we are supposing it is a tap water. So ده قصة تانية بقى هتسمعها من زمان. يعني احنا بقالنا ساعة زمان. We have to inject a clean water. Okay, how much? Sorry. مش مشاكل، الراجل بيرجع عليك بس. ده عقبك.
هو ده
مية. تمام؟ How much? In adult, we can use 100 up to 300 milliliter per wash. This one is 50. Okay, so I get 2, so it is 100. Inject 2, then aspirate this 2, inject 2, and aspirate this 2. Like this. Inject 1 and wait. Inject another one, then remove and discard. Remove and discard. Till what? The entering is clear and the out is clear. In children, we cannot use tap water. We have to use saline because tap water can produce hyponatremia in children, but adults can tolerate tap water. So we have to use saline. How much? We can use the fixed 100 milliliter because it is like this, 5 to 10, 10 to 15 milliliter per kg. 10 milliliter per kg. If a child is 1 year, he is 10 kilogram, 10 multiplying by 10, it is 100. So you can fix for your clinical practice 2 syringe in, then remove this 2 until it is clear. After washing the stomach, we have to put, if it is indicated, what's called activated charcoal. This black one. It is a black powder. Its dose is 1 gram per kg. 1 gram per kg. This is activated charcoal.
in case of any toxicity, gastric toxicity.
In case of most of toxic ingestion, you can dissolve this in tap water and inject it through the tube and left it in the stomach. Don't remove it. How much? 1 gram per kg. If I am 60 kilogram, how much? 60 gram. The 1 spoon, the full spoon, is 10 gram. So I cannot have a weight measurement. It is 10 spoon. 10. So I am 6 spoons diluted in water and then injected in the patient. الحسبة 1 جرام لكل كيلو. أنا 60 يبقى عايز 60 جرام. المعلقة بتاع الأكل 10 جرام. يبقى 6 معالق. أدوبهم في عصير وأسحبهم وأحطهم. حلو الكلام؟ I have finished. How to remove this tube? Like this. I have to put the patient in sitting position. I have to sit our patient. Then please take a deep breath. Please hold the breath. Then I remove it gently. We have a column of water. If this is if this end is opened, this happen in the chest of the patient. So you have to close the end of the tube. Okay? Is it easy or difficult? I have finished the end.